Well, it is my pleasure to introduce all of you to Dr. Mark Stein, a oral and maxillofacial surgeon. Dr. Mark Stein, welcome to the LOCALlist.
How are you? Thanks for having me today.
I am great and so excited about our conversation. So first, just to introduce you to everybody at home, you know, you're based in New York, but you treat patients not just from all over the country, all across the world. So what is drawing so many people to you?
Well, we have a practice based out of New York City on Fifth Avenue, right in Midtown. And the scope of our practice really involves oral and maxillofacial surgery, but specifically areas that other oral maxillofacial surgeons may not be doing as much of or have as much expertise in. Some of these are specifically Botox injections for tooth grinding and effects of tooth grinding and clenching, as well as complicated jaw reconstructive surgery, jaw bone regeneration in preparation for dental implants.
Well, something that you said that just really jumped out to me was tooth grinding. I think especially amid the pandemic, people feeling stress and anxiety, it's a habit a lot of people may have picked up who didn't do this before. And whether you grind your teeth or know somebody who does, we can kind of all relate to this. So what are the dangers or damage caused by this habit?
Over the last 2 to 3 years during the COVID pandemic, we've seen an incredible spike in patients grinding and clenching their teeth, obviously because of reasons of stress and anxiety, whether it's jobs that were lost, offices that were closed. In today's world, it's inflation, gas prices, you name it, people are stressed out. So when they clench and grind their teeth, there are effects to that. Specifically, teeth can fracture and break.
Yeah, it sounds quite painful too. And of course, you can help with the repair and reconstruction of somebody who does break a tooth or multiple teeth. But I'd really love to learn about some of those prevention techniques. I'm familiar, I guess, with Botox for cosmetic reasons on the outside. But when you said Botox could actually help with teeth grinding, that's interesting.
We are injecting very small amounts of Botox into our jaw muscles. So one of our larger jaw muscles located here on the side of the face called the masseter muscle. It's a muscle that's involved in chewing and also subsequently in clenching and grinding. So if someone can put their teeth together and squeeze, you'll feel that this muscle gets larger. In some patients who are habitual clenchers or grinders, that muscle can get really large. And based on the size of the muscle, it exerts an incredible amount of force, which then translates into force on your teeth coming together hundreds of thousands of times during the night. And that force can cause a tooth to fracture. By injecting a small amount of Botox into this muscle, it will relax the muscle. It will reduce the amount of force with which someone can clench.
Any little nuggets you can give us, so to speak, to improve our own dental health? Or is there anything that you're working on that we should keep our eye out when it comes to technology? Let's get the inside scoop on something.
Sure. So most importantly is for you to see your dentist regularly, and that means usually twice a year. Seeing your dentist can potentially prevent issues that may arise. Dentists can check for your bite to make sure that your teeth come together correctly. They may check for some potential problems that may be looming down the road, which they can address later. One important aspect of clenching and grinding effects on teeth prevention is making a custom night guard. Oftentimes patients may purchase a night guard in the store, but that's really not as preventative as having a custom one made. It's made specifically to fit over your specific teeth, not a one-size-fits-all. And making a night guard in combination with Botox injections is seen to be the most beneficial for patients that clench and grind.
All right, wonderful. Thank you so much.
My pleasure. Thank you so much for having me today.